Hyperthyroidism. In easy word, hyperthyroidism means your thyroid gland become overactive and make too much thyroid hormone. These extra hormones speed up all the body functions like heart rate, metabolism, and energy use, making the body work faster than normal. Causes. These are the few important causes of hyperthyroidism. Among them, the grave disease is the most common cause of thyrotoxicosis. It is an autoimmune disorder and characterized by increase in synthesis and release of thyroid hormone. In grave disease, the autoantibodies known as thyroid stimulating immunoglobulin or thyrotropin receptor antibodies bind to the TSH receptor in the thyroid cell membrane and stimulate the gland to overproduce the thyroid hormones. It may occur at any age, with a peak incidence between 20 to 40 years of age. Females are affected 5 times more commonly than males. Hyperthyroidism may be triggered by viral or bacterial infections, for example, E. coli and Yersinia. These organisms possess cell membrane TSH receptor. Antibodies produced against these microorganisms can cross-react with the TSH receptor of the body because of their molecular mimicry and can cause hyperthyroidism. The second important cause is the toxic multinodular goiter, which is also known as the plumber's disease. Normally, the thyroid gland is under the control of TSH from the pituitary, and it makes hormones only when told to. But in this condition, some part of the thyroid called nodules start to act on their own. These nodules become autonomous, meaning they no longer listen to TSH. They keep producing thyroid hormones continuously, even when the body doesn't need them. As a result, the person develops hyperthyroidism because too much thyroid hormone is being released. When there are multiple overactive nodules, we call it toxic multinodular goiter. When there is only one overactive nodule, we call it toxic adenoma. This problem is more common in older adults, and especially in areas where people don't get enough iodine in their diet, because iodine deficiency often leads to goiter formation in the first place. And over time, some of those nodules start functioning independently and become toxic, meaning they produce excess hormone. And remember this, about 5% of the patients with toxic multinodular goiter may also have thyroid cancer in one of their nodules. So always evaluate these nodules carefully to rule out malignancy. Now, drug-induced hypothyroidism. The drug-induced include iodine, amiodarone, interferon alpha, and rarely lithium. Excess iodine intake can affect thyroid hormone production in two opposite ways. It can lead to hyperthyroidism in some people and hypothyroidism in others. Let's understand how that happens. When a large amount of iodine suddenly becomes available in the body, the most healthy individuals have a natural protective response. The thyroid temporarily slows down hormone synthesis to prevent excess thyroid hormone formation. This protective mechanism is called the Wolff-Chaikoff effect. And if this suppression continues for a long time, it can result in hypothyroidism. However, in certain individuals, especially those who already have underlying thyroid disorders such as multinodular goiter or latent grave disease, their response is quite different. Instead of shutting down their thyroid gland, they may start producing even more thyroid hormones. And if it continues, it can result in hyperthyroidism. This abnormal response to excess iodine is known as the Jode-Basedow phenomenon. And the common sources of excess iodine include intravenous or oral potassium iodide supplements, certain foods, or exposure to radiographic contrast media or iodine medication. The second important drug that can cause hyperthyroidism is amiodarone. Amiodarone is a powerful antiarrhythmic drug. Interestingly, it contains a very high amount of iodine, about 37% of its weight. Just 200 milligrams of amiodarone can produce nearly 75 milligrams of iodine, far more than the body's daily requirement. Because of high iodine content, the amiodarone can significantly affect the thyroid gland. In patients who already have thyroid conditions such as multinodular goiter or latent grave disease, the excess iodine from amiodarone can overstimulate the thyroid gland, leading to hyperthyroidism. That is the Jod-Basedov effect. And secondly, due to the direct toxic effect of amiodarone on the thyroid follicular cells, this damage causes the stored thyroid hormone to leak into the bloodstream, producing a transient thyrotoxic phase. Over time, as the gland becomes depleted and damaged, this phase may progress to hypothyroidism. So in summary, amiodarone can cause hyperthyroidism either through Jod-Basedov effect or by direct cytotoxic injury, and in some cases it can eventually lead to hypothyroidism. Amiodarone-induced thyrotoxicosis can occur at any time during treatment and may develop several months after treatment discontinuation. Amiodarone is the leading cause for thyrotoxicosis. However, it can be hard to recognize this condition in patients taking amiodarone. This is because in thyrotoxicosis, we usually expect symptoms like a fast heartbeat, that is tachycardia. But amiodarone itself slowing down the heart rate, it can cause bradycardia. So even if the person is having a thyroid stroke, their pulse might look normal or even slow, which can hide the warning signs and make the diagnosis easy to miss. Now in pregnancy, human chorionic gonadotropin can bind to thyroid TSH receptor. Very high level of serum HCG, particularly during the first 4 months of pregnancy, may cause significant receptor activations to cause gestational thyrotoxicosis. About 20% of the pregnant women have a low serum TSH during pregnancy, but only 1% of such women have clinical hyperthyroidism that require treatment. Now, some rare cause of thyrotoxicosis. The first one is the Thyrotoxicosis Factitia, is due to the intentional or accidental ingestion of excessive amount of exogenous thyroid hormone, especially thyroxine, causing thyrotoxicosis. The patients are clinically thyrotoxic without the eye sign of grave disease. Treatment include stop thyroxine and give symptomatic relief drugs. Normally, the thyroid tissue is found only in the anterior neck, but sometimes the small piece of thyroid tissue can grow in unusual places such as inside the ovary. When this happens, this is called the Struma ovarii. Usually occur as a part of an ovarian tumor known as dermoid cyst or teratoma. This thyroid tissue can behave just like a real thyroid gland, and it can produce thyroid hormone and sometimes cause hyperthyroidism. These are the few causes of hyperthyroidism.